A Wuhan resident with no coronavirus infection was forced to stay in the hospital with other infected patients. She told us the hospital only gave her a temperature check and would not let her go. And in exclusive, internal documents obtained by NTD reveal China's epidemic prevention measures focus on maintaining stability but not saving lives. U.S. confirms first case of unknown origin. The CDC said the patient did not travel anywhere known to have the virus or come in contact with anyone known to be infected. A new clinical study reveals the coronavirus is much deadlier than SARS. The study concluded that the novel coronavirus could infect the nervous system, the respiratory system, and skeletal muscle.
Welcome to China in Focus. I'm your host, Tiffany Meyer. So how deadly is the new coronavirus? In a new clinical study published in medical platform medRxiv, which publishes papers that have not yet been peer-reviewed, a team of doctors in China studied 214 coronavirus patients in 3 different hospitals. The study concluded that the novel coronavirus could infect the nervous system, the respiratory system, and skeletal muscle. This makes the novel coronavirus much more dangerous than SARS, which could only infect the respiratory system. In addition, the study found patients whose nervous systems were infected were more likely to die. And while the virus can be deadly, more than 80% of cases so far have only mild symptoms. That's according to a study published recently by the Chinese CDC. But mild symptoms could also make the epidemic harder to contain because they're less likely to seek medical help. And an exclusive, internal documents obtained by NTD reveals China's epidemic prevention measures focus on maintaining stability but not saving lives. A security briefing from Hubei province on February 22nd detailed how around 3,300 so-called sensitive and harmful messages from online platforms were deleted. And then they pushed over 200,000 so-called positive messages about the situation amid the virus outbreak to sway public opinion. Over 600 so-called rumors were deleted and the writers were given a warning. The briefing also mentioned how several so-called hostile media were continuing to spread so-called lies about the origin of the coronavirus being engineered by humans. An exclusive report from a Beijing-based media delves into the origin of the coronavirus gene sequencing. According to the chief physician of the Department of Respiratory Medicine at Wuhan Central Hospital, his hospital sent a sample of the first confirmed case of the coronavirus from the South China seafood market for testing. That was on December 24th of last year. 3 days later, on the 27th, the testing agency also confirmed it's a novel coronavirus. The report added that before December 31st, no less than 9 samples of the unknown pneumonia had been genetically sequenced. The report confirmed the pathogen was a SARS-like coronavirus. But when doctors like whistleblower Li Wenliang tried giving similar information to others in a WeChat group, they were silenced and punished by authorities for spreading so-called rumors. That's not all. The report also revealed a gene sequencing company received a phone call from Hubei Province Health and Medical Commission on January 1st, telling them if there are any samples of the novel coronavirus, they cannot be re-examined, adding that such case samples must be destroyed. Such information could not be disclosed, and related papers and data could not be released to the public. The official notice of the novel coronavirus was not released to the public until January 11th, 15 days since the sequencing had been confirmed. So why was there this long wait before making the information public? This report has since been deleted. And a new study conducted by the European and German Chambers of Commerce in China found that a quarter of European businesses in China expect a revenue drop by 20%, and that's just in the first half of the year. And Facebook on Thursday announced its decision to cancel its annual F8 Software Developer Conference due to concerns surrounding the coronavirus outbreak. And Microsoft now has plans to hold a digital-only event from March 16th to 18th. Meanwhile, Starbucks said on Thursday it has reopened 85% of its China stores. The CEO said this was a response to the slowing numbers of official cases in China. And outside China, Iran has the highest death rate. 2 high-level officials on Thursday were also confirmed with the coronavirus. One is the vice president, and the other is the chairman of the parliament's National Security and Foreign Affairs Committee. The same day, Saudi Arabia closed its borders amid fears of the coronavirus. This effectively halts foreigners making the pilgrimage to Islam's holy sites. The 2 holy sites, Mecca and Medina, usually see millions of Muslim visitors throughout the year. South Korea reported 505 new cases Thursday, marking its largest daily jump since the first patient was confirmed on January 20th, and taking the national tally to over 1,700. That's according to the Korean CDC. And in Italy, Lombardy's governor has put himself under self-quarantine after one of his employees came down with the coronavirus. Germany's health minister said Wednesday that the country was at the beginning of an epidemic. This after new cases sprung up that can no longer be traced to the virus's original source in China. He added there is no need for lockdowns in affected areas. And German doctor and biochemist Alexander Kekuli from the Martin Luther University of Halle-Wittenberg said in a TV interview he does not believe the virus will be controlled within a short time frame. He expects the coronavirus to continue appearing for months, possibly years. A Wuhan resident not infected with the coronavirus was forced into quarantine with those suspected of having the virus. In a living nightmare, she was also refused treatment for her ailments. NTD's Li Xing'an has the details.
Not infected with the coronavirus, but can't leave the hospital. A Wuhan resident is now facing a difficult situation.
The hospital won't let me leave, but they also won't arrange the coronavirus test. They just let me stay here. There are other patients in my room. All of them have both lungs infected.
Zhang started having a low fever in early January. CT scans showed no infection in her lungs, and doctors said she wasn't infected. Yet she was forced into quarantine because it's required by authorities for anyone who has a fever. But to receive treatment for her fever, she had to prove that she wasn't infected with the coronavirus. Local authorities sent her to a hospital. She lived in a room with 3 other suspected cases. Zhang got no treatment, only temperature checks. Yet the hospital wouldn't let her go, though it was unclear when the next test would be arranged.
The hospital doesn't care. They have too many patients and they're numb. They don't care about you.
We got in touch with Zhang again before publishing this video. She said she tested negative for the coronavirus for a 3rd time and was finally discharged from the hospital. But now she has to be quarantined for 14 days again because she stayed in the same room with patients who are suspected of having the virus. Reporting by Li Xin'an, NTD News.
For the first time, a U.S. patient has contracted novel coronavirus with no clue as to where it came from. U.S. Centers for Disease Control and Prevention said the California patient didn't travel anywhere known to have the virus, and the patient wasn't exposed to anyone known to be infected. California officials said the person is a resident of Solano County, northeast of San Francisco, and is getting medical care in Sacramento County. They said they have begun the process of tracking down people who the patient has been in contact with, a process known as contact tracing. The patient was brought to UC Davis Medical Center from another Northern California hospital on February 19th. Health officials have been on high alert for so-called community spread. And Iran has the highest number of deaths from the coronavirus outside China, with official reports at 26 so far. But the outbreak there could be even worse than reports suggest. Our France correspondent, David Vives, has the story.
Narges Khanalizadeh is among the first victims of the coronavirus in Iran. The nurse's death stirred up emotion on social networks. Although she tested positive for the coronavirus on February 26th, according to Iran's regime, she died from the flu. Khanalizadeh's case challenged the official narrative on the coronavirus. She's not the only one. As we can see people posting information on the coronavirus situation in Iran that depicts a reality much different from the information released by the regime. Iranian MP Ahmad Farahani declared to the press on February 24th that in the region of Qom, the virus killed at least 50 people. At that time, the Iranian regime said there were 12 deaths in the whole country. According to former diplomat and Middle East expert Nidar Nouri, the regime is covering up the coronavirus. The virus outbreak started 3 weeks ago in Iran. This has been confirmed by some MPs, but our source is the medical staff and nurses who share their information on social networks. According to Nouri, the regime covered up the outbreak while important events took place. February 11th marked the 40th anniversary of the Iranian Revolutionary Guards, and MP elections were held on February 16th. But the outbreak came to a point that was no longer possible to conceal. Iran's Vice Minister of Health was infected with the virus, and more officials could be infected by now. According to our sources, several mullah and high-ranking officials are now infected by the coronavirus. China is the first business partner of the Tehran regime, and for Nouri, this might explain why the outbreak is affecting Iran so seriously. The regime is so dependent on China, despite warnings coming from the WHO and medical agencies throughout the country. As flights between China and Iran continue, Mahan Air, the first plane company, made at least 55 flights since the beginning of the outbreak. Meanwhile, the Iranian regime accuses Washington of triggering fear over the coronavirus. U.S. Secretary of State Mike Pompeo said that Iran may have concealed vital details about its outbreak. He also urged all nations to tell the truth about the coronavirus. David Vives, NTD News.
And in Japan, the Prime Minister asking all schools to close from March 2nd until the upcoming spring break to help contain the coronavirus.
I request all elementary, middle, and high schools and special needs schools be temporarily closed from March 2nd until spring vacation.
Prime Minister Abe said there are many efforts being taken to stop the spread of infection among children in various regions. He added that the next week or two will be an extremely important period in halting virus spread. According to local media in HK, 13 new infections were confirmed in the main northern island of Hokkaido, among them 2 children under the age of 10. The number of cases in Japan has now risen to more than 200. Meanwhile, the Japanese government has urged its people to cancel big gatherings and sporting events for 2 weeks. At the same time, it pledged that the 2020 Summer Olympics will go on as planned in Tokyo. International Olympic Committee member Dick Pound said it's possible to reschedule an Olympics for a year later.
The worst possible outcome of this virus, and it becomes a real pandemic where world health is at stake, then we reluctantly have to say, well, that's more important, frankly, than the Olympics.
But he also wanted athletes to know the committee will do its best to ensure they get their chance to compete.
Auto plant closures in China due to the coronavirus have disrupted the industry's global supply chain. General Motors sales in China now down 40%, and plants in South Korea have shut down because of a shortage of parts. The industry is taking a big hit financially, as now they have to ship parts in by air. NTD's Kevin Hogan has the story.
The automotive industry has started to feel the impact of the coronavirus. Lockdowns in Wuhan and other plant closures have already started to affect car sales and production. China is one of the world's largest car parts suppliers, exporting nearly $35 billion in parts in 2018. And U.S. automakers are by far the most reliant on China, taking in about a third of the exports. A senior managing director at a global management consulting firm explains the extent of the impact the virus is having on the auto supply chain.
Yeah, the coronavirus in China is already having a global impact on the automobile industry. The automakers with plants in China, specifically in the Hubei province, have been down now on the extended Lunar New Year and are still not slated to be back up and running until around the 10th or 11th of March. Other car companies throughout China, Japan, South Korea are struggling with parts supply coming out of China. And the automakers in Europe and North America at this point in time have not been directly impacted to a great scale, although they are very closely monitoring the supply of parts that they're receiving.
Right, and since China is a major producer of car parts, it certainly seems that these factory shutdowns can really pose a problem. And now reports show that the coronavirus is spreading into other countries. How has that affected the supply chain?
So there are now obviously confirmed cases in South Korea, which has caused the supply chain there to be limited and automakers there to be limited in their production. We've now seen the spread of the virus into northern Italy, which is a manufacturing and industrial area, and we've seen it spread into Iran as well. So this has now become a global problem, and it's a little bit difficult at this point to predict how extensive this is going to be, but it is clearly a global problem at this point.
Clearly, we're facing an international crisis. Now, how long can these car manufacturers hold out without a steady supply chain?
Well, if we can't get people back to work and the supply chain infrastructure running again within a couple of weeks, we're going to start to see downtime in North and South America as well as in European automotive production.
The expert says the automotive supply chain has proven to be resilient, and he expects the industry to be able to recover. He does not expect car prices in the U.S. or Europe to rise. Kevin Hogan, NTD News, New York.
Now to the luxury goods market. The coronavirus could cost it billions, according to a recent survey by industry executives. This comes as new cases of the virus have surged outside of China. Our UK correspondent Jane Werrell has the story.
Giorgio Armani showcased its collection to an empty room at Milan Fashion Week. The brand chose to stream its catwalk to a remote audience on Sunday over concerns about the coronavirus. Michael Kors was forced to cancel over similar fears. Reports say the virus was the main talking point on the ground. After Milan, Paris Fashion Week opened, though with lower attendance from Chinese buyers and cancellations from designers. The virus continues to cast its shadow. Compared to the realities of this health crisis, luxury fashion seems unimportant, but the impact on the industry is by no means small, as this data shows. Brands have become increasingly reliant on the Chinese market over the past 2 decades. Chinese taste for luxury has grown, with Chinese nationals accounting for around 35% of global luxury purchases. During the SARS outbreak in 2003, it was at just 2%. 28 top executives surveyed this week anticipate a $33 billion to $43 billion hit to luxury sales. Travel restrictions have held back sales both inside and outside of China.
25% of the world luxury market is Chinese tourists. 25%. It's huge.
Saboni, who runs a data intelligence firm for luxury brands, says Chinese consumers are turning to online purchases.
So you will engage much more digitally. Maybe you're going to engage more with virtual reality, trying the makeup on your phone and so on, because you're staying home for 2 weeks, 3 weeks.
Perhaps we'll be seeing more streaming of shows like Armani's to remote viewers.
And at CPAC, we sat down with Representative Matt Walker, who gave us an insight into the latest discussions on the coronavirus in Washington. He said at this point, getting people to understand what the outbreak could become is what matters most right now.
What preparations, what kind of scenarios are being talked about, I guess both in terms of the potential health crisis and also economic repercussions worldwide?
I think the first thing all across the Hill today, in fact even in our leadership team this morning, our conference this evening, we were making sure that people understand the serious nature of what this coronavirus could be. It's kind of like preparing for a hurricane, being a native Floridian. You don't know where it's going to land, but it's go ahead to get out in front of it and start the preparing. That could come from a funding standpoint, but also from the healthcare side as well.
So practically speaking, what kind of scenarios are being talked about?
Well, we don't want to forecast too much. We've got 15 Americans right now that are impacted. We did get reports late out of China today that some of this is subsiding, so to speak, but we take that with a grain of salt. Sometimes China doesn't always shoot straight with us. As really the ranking member on intelligence and counterterrorism, we are constantly pushing back on some of the cyber attacks and other things. So we're wanting to make sure this is legit. If it is, we celebrate with it, but we want to make sure, and the president deserves a little bit of credit, even going back as far as January 6th to even getting Americans, making sure they were taken care of, but even offering some of the support to the mainland that was denied at first, yes.
And on the economic side, are there also preparations going on there?
There are. In fact, I was just back in North Carolina talking with a group that was connected with a hardware company that by April, if something doesn't happen, they're going to start hemorrhaging because of our dependence so much on China. Even the mask and some of the things that we would consider security items are made there. So we've got to really move quickly when it comes to our independence and making sure that we do not have a shortfall in these areas.
So is that looking for different supply chains or domestic manufacturing?
Supply chains is exactly, you fully understand this process. I think we're even working on that moving now. Obviously the government has a certain role in it. We can't dictate or usurp our will on the private sector, but our job is to maybe create some space where some modifications could be made.
All right, thank you very much.
Thank you, my privilege.
Here at China in Focus, we bring you first-hand information from inside China. Don't forget to subscribe for the latest updates.